First, though, let's get a condition check on the Formula One driver Jules Bianchi, who's had surgery on a serious head injury after he crashed in the Japanese Grand Prix. Our reporter, Craig Slater, is outside the hospital where he's being treated. Craig, very good morning to you. What can you tell us?
Good morning, Mike. Yep, I'm outside the hospital at the moment. We're not getting any official details from the hospital itself, but I can tell you that I understand he is still in a very critical condition, Jules Bianchi, still fighting for his life. And I can clear up a couple of aspects of misinformation that have been going on, that have been picked up particularly by the French media and one or two outlets in the UK as well. I can confirm that Jules Bianchi is not, unfortunately, breathing unaided. My understanding is he still relies upon a respirator at this point to be able to breathe. And the other story which emerged overnight, I can also confirm is not the case, that he has not undergone a second surgical procedure. My understanding is he went through one surgical procedure at about 11 p.m. Japanese time, which is 3 p.m. on Sunday afternoon UK time, and has been in intensive care since then. So just to repeat that, my understanding is he is not breathing unaided, and he has not undertaken a second surgical procedure. He remains here in intensive care, and we're not likely to get any more details about his condition, although we understand it's critical, until his family arrive. Both his parents are flying out from the south of France. They're going to have to come here via Dubai, but because of Typhoon Fanfone, there are major delays to flights in and out of Japan at the moment, delays typically between 6 and 8 hours, so it may not be the case that Jules Bianchi's parents arrive here till late this evening, and we may not get very much more detail on his condition until then.
Craig, everybody across the world hopes he's in the best possible place, getting the best possible care. What can you tell us about where he's being treated?
He's at this Mie Prefectural General Hospital. That's effectively a state hospital. It's an establishment of around about 500 staff. They have 100 doctors on their roster. Significantly, however, this was the hospital nominated by the Suzuka racetrack to receive trauma patients. They were on standby for track-type injuries if they should occur. So they had a team of 4 neurologists that were able to act when Jules Bianchi was brought here. It is something of a speciality for this hospital itself, brain surgery, so they did have the staff and relevant equipment in place. They also had an air ambulance service, and this is one slight grey area which we're trying to investigate further, because we saw that the medical helicopter take off from beside the medical centre at the Suzuka racetrack yesterday, but it was not able to land here at the hospital. And the question remains, if there wasn't an air ambulance service available from the racetrack to the hospital, why wasn't that called off? Whose responsibility was it to ensure that the helicopter could fly to the hospital at all times? Because according to Formula One rules, track sessions are not allowed to get underway unless there is a viable air ambulance service. We've seen in the past hold-ups to practice sessions and that kind of thing because the air ambulance couldn't fly or the air ambulance couldn't get to its relevant destination. So that's something we're looking into at the moment. The hospital have only confirmed to us that it was because of fog that the air ambulance could get here. They've also confirmed that, yes, it would be normal procedure for someone to be taken in the air by helicopter from somewhere like Suzuka to the hospital. However, there were other complicating factors in this case, as I understand it, and it was partly, at least for medical reasons, that Bianchi came here by ambulance. He was admitted at 5:36 p.m., so roughly 45 minutes after the accident itself took place. But he is in good hands. This was the nominated hospital that any injuries sustained on the track, any injured individuals were meant to be brought to. So we'll continue to monitor his situation here, and hopefully we'll get some sort of update in the next few hours.
Craig, let's hope so. Thank you very much, Craig Slater, keeping a close eye on that.